All right. So this meeting right now is being recorded. On the Zoom side, if there's anything that any question that you have, please use the chat window. On the Clubhouse side, if you have any question, please raise your hand. And what I want to do is I want to cover this in about 45 minutes. Regarding the topic for today. And then the rest of the 45 minutes are open to discussion, sharing, or questions. Um, and it's actually not easy for me to, just prepare this and just talk it out loud. I really prefer, very concrete feedbacks or sharing or questions. And so your sharing will definitely help me to dive deeper into the subject. Okay. So let's go. So why? Right. Um, because we are indeed an entire person, right? We're not just physical person, we're not just emotional person, but we're very, very interconnected. If we go back to the first slide. Oh, by the way, on Clubhouse, please see my bio. Okay, so in my bio, there is a MCA 7 talk series and videos, and underneath there's a https tinyurl.com talkmca-en for English. So that's a Google Share Drive, and in there you'll be able to find the first slide. And that's the um, the slide that we're focusing on today. Um, yeah, we're entire being, right? And our physical state can affect our channels. And if you look at the first picture, the first slide of the slide deck, all these arrows are bidirectional. So the physical state can affect channels, and because it affects channels, it can affect our emotions, and vice versa, right? If we're angry all the time, it will affect our channel. If eventually, it's going to cause us physical issues. Um, so MCA, this whole approach is really designed to see all aspects, to consider all aspects of a person in the clinic setting. And my healing definition, okay, if we pause for a while and just think, what's my definition of healing, right? So if we say, okay, my definition of healing is, for example, to be free of cancer. Okay, that seems to be a good definition, or to be free of my arthritic pain. That seems to be a good definition, right? But to me, in my clinic, my definition is healing is our connection, our heart connection to loving kindness. And why? Because that's something we can do all the way until the very last breath. And if we do that, not only do we die a good death, we also leave our loved ones a very, very, very precious gift, because we will be leaving in peace instead of in agony or huge attachment and serious pain. Okay, so that's my definition of healing, and that's what I use, and that's what I share with my patients. So this MCA is entirely anchored on Chinese medicine channel theories, and this and I'll share more. And this is what this talk is about. So channels are ever changing to match our physical, emotional, and spiritual states. And when I say ever changing, that means instantaneously. If I say, hey, what's behind you? Your channel changes. Okay, instantaneously. That's how fast our channel changes. And it has to, right? If we're in any danger, if we're walking on the street and there's, there's something coming at us, we need to change right away to account for that, for whatever that's happening to us. In order to protect ourselves, we need, the channels changes instantaneous to match whatever we're facing. to have an approach that allows me to treat or to see my patients not based on symptoms or use any protocols, which I really, really have problem with. Okay. So if you go to a doctor, if you're not a practitioner, if you go to a doctor and they say, oh, okay, based on your, if you're coughing and this is what they do, if you have pain, that's what they do. Um, I literally have patients who are diagnosed with Parkinson and the doctor never ever, touched this patient, never felt the muscle state, never see how, what her rigidity or her tremors are coming from. And they give her a diagnosis of Parkinson. And that, these are the things that I see over and over again because most doctors diagnose based on symptoms, based on a list of symptoms. And if it matches 80% or something like that, oh, boom, you have this. And based on that label of a disease or a condition, it can prescribe a protocol-driven treatment. Right? To me, that's very, very far from healing. Okay. And also, I want a approach, this mindfully centered approach, to be insightful, immediate, and empowering. And indeed, this is what I observe in the clinic, and many of my patients are testimonial of this. Right? Some of the recoveries from PTSD, anxiety, depression are just extremely fast, extremely fast. Okay. So I'm going to go over really quick. Basically, we have 14 channels. The first, this picture shows 2 channels. Basically, it comes from what we call the Ren 1. It's from the perineum area. Okay, I think I can grab a, spotlight. Okay. So here's the Ren 1. So that's at the perineum. To me, that's a very, very critical point. Okay. If we can very, very slightly elevate this point in our body, just very mindfully, very, very slight, elevate this point in our body, then we're basically, essentially, we're in our body now. We're present in our body. A lot of the trauma patients couldn't do this. Okay, people who suffer abuse, any kind of abuse, a lot of times that's the point they have no contact with. It's like, what do you mean? I can't do that, um, because when they get into their body, there's severe emotional and physical pain. Okay, so the Ren channel and the Du channel originates from this parent, essentially originate from this point, and the Ren channel go up, through our abdominal area, through the chest, through the throat, which is very, very important, and into our mouth, and the Du channel runs in the back along the spine. And the key for the Du channel is it actually enters during the daytime, enters at the occiput, which is the between our head and our neck, okay, and enters our midbrain and coming out of in between our eyes. So during the daytime, the Du channel is supposed to energize our midbrain to allow us to have clarity, to not worry too much, to be very, very present, to be connected in the universe. So that's, in my mind, the Ren channel and the Du channel are super, super critical. The way we can activate it right now, okay, let's give it a shot and see how it works. Okay. So again, elevate our perineum ever so slightly. In our heart, we're going to have this tremendous sense that I have a purpose. And from our third eye, we're going to connect to loving kindness, whatever that means to you. Could be God's love, could be Jesus' compassion, could be Buddha's compassion, could be the favorite dog you ever own. Something that represents unconditional love. And let's do this one more time. Elevate the perineum ever so slightly. I have a purpose, deeply from our heart. And from our third eye, or connect to loving kindness. and really experience and feel your body sensation. This is how an active Ren channel and Du channel is supposed to make us feel. And this is our choice. We can do this anytime we want, anytime. So the following 12 channels, so we have Ren channel and Du channel, and there are 12 more, so it makes a total of 14 channels. The following 12 channels are bilateral. Okay, so if you see, for example, on this slide, we see the lung channel. Lung channel actually, we have bilateral, which means symmetry. Okay, so it mirrors on the other side. So lung channel goes from basically the chest to the thumb, and then it joins the large intestine channel, and then from large intestine channel it goes down as the stomach channel. Okay, so I'm not going to go through this one by one, but the key is all these 12 channels, they are joining together as if they're one channel. They form a very, very close loop system. So one channel will supply the energy that the next channel needs, and so on and so forth. Okay. So the problem can occur if one channel has a blockage. For example, if there's a C-section or a knee replacement, or severely injured ankle, for example, then they start to block a channel. So one channel when one channel is blocked, it starts to affect our entire body, entire system. Okay. So a headache, a migraine might be started by stepping on a nail, like 3 months ago. Then all of a sudden, this person starts to have migraine issues, or a dog bite on the side of a shin may start to have tremendous problem elsewhere. Okay, why? Because all channels are related. They go one after another, one after another. So any channel issues needs to get resolved. So the channels run as almost like a pipe, right? Like a plumbing system, right? So when the plumbing systems are operating efficiently without clogging, right, without blockage, we don't notice anything. Life is good. But when there's something wrong and the toilets start to, you know, um, to flood, then we notice something. So our channel systems are very, very similar to that. Okay, so instead of saying, okay, I have a toilet problem, we don't have a toilet problem. We have a plumbing issue. Okay, somewhere down the line, it's blocked. So as soon as we remove the block, we fix the problem. So it's the same methodology, same approach when it comes to channels. Okay. So the channels that I learned are very, very different than the Chinese medicine channels that's normally taught. So I got this from Dr. Janice Hellock, Tracking the Dragon book. And if you're practitioners or if you're very, very interested in this subject, please check this book out. Every part of our body is covered by channels. All living beings have channels. So dogs have it, cat have it, you name it. Okay. And channels is not a creation by Chinese medicine. It is ever present, just like the gravity. So it's always there. They are electrical in nature. So scars with its keloid tissue basically generate higher resistance. So when channels are trying to flow through scars, it has trouble. It couldn't. It's almost like through a huge boulder in the middle of a river. And then the water has to evade, has to somehow get around that boulder. Okay. So that's why, in I think it's tomorrow. Yeah, tomorrow we'll be talking about the physical aspect that can affect channels. So we'll be talking more in depth about scars. And again, channels can be affected by physical, emotional, and perspective issues. And channels, honestly, are most vibrant, aligned to the universe. When we say we have a purpose and we literally connect to loving kindness, which what we just did. Okay. So if we can, honestly, if we can do that, for example, if I can be in a meditative state, or if I can pray to God all the time, then my channels will be running almost in perfect condition all the time. The question, the reality is we don't do that, right? So then it's then it's very very important to keep our physical health, emotional health, and perspective health in check, um, just so the channels can run smoothly. Okay, our channels have four modes. Okay, this is very seldom talked about. Okay, uh, so Ayla, I'm gonna mute you, turn off your mic for the time being. Okay. Um, so there are four modes for our channels. They're sympathetic, which is fight and flight. They're parasympathetic, which is rest and heal, and that's our treatment goal. Okay. And there's sleep and pause and dissociation. Very few people talk about this, okay, especially the last two modes, okay, especially the last mode, pause and dissociation. Okay, so let me cover each and cover them all. Okay, so fight and flight, very very important. So fight and flight, essentially, when we're in fight and flight mode, we open up our airways, elevate our heart rates and our blood pressure. Super super important when we're faced with danger, or if we have to run away from danger. So, so the fight and flight mode, the purpose is really is to go as far away from danger as possible. Okay, and parasympathetic is what we do in the clinic. In the clinic, that's the mode we're trying to achieve, um, so people can rest and heal. Uh, you know, eh, because indeed our body is really designed to heal itself as long as we remove the impediments or the blockages that's causing issues in our channels. The sleep mode. So essentially, we have a gallbladder channel that runs from our the side of our left and right brain all the way down to our little toes. Um, so around 11 o'clock at night, this one channel, which we call gallbladder channel, runs vigorously, more vigorously than all the other channels. And because the gallbladder channel goes down, and the DO channel that goes from perineum all the way up through our spine into our head are going up. And because they're electrical, channels are electrical in nature. So when one channels or one electrical line goes down more vigorously than the other one is actually being dragged down. So that's why around 11 o'clock, most people are kind of sleepy, but after about 1 a.m., which is, that becomes the liver time, which is another channel's time to surge, we're actually, completely lost our sleepiness. Okay? So a lot of people wake up around 1 a.m. Or 3 a.m. or something like that, and there's a very, very good reason for that. The pause mode and dissociation, these are super critical because I do PTSD, I do severe trauma resolution. I see these two modes very, very often. Okay, let me give you an example of what a pause mode look like. Okay, let's say I'm a mouse and I'm being chased by a cat. So in the beginning, I would be in fight and flight. I'll be in full sympathetic mode, trying to run as far away from the cat as I can. By the time the cat catches me and perforated my skin, I will go into what we call the pause mode. Okay. So in pause mode, all my channels, all the energy, all the 12 channels, all the 14 channels that we talk about, boom, all of a sudden goes into the DO channel. Okay, all of them, all at the same time, instantaneously. Why? To save my life. Okay, so if my skin is perforated, let's say my artery is perforated by the cat. So if none of my channels are running, all of a sudden my blood pressure goes way down, my heart rate goes way down. So if any of my vein or artery are severed, I will not be bleeding like a fire hydrant. I will not be bleeding to death, very, very quickly. So that really saves time, right? So that can potentially save my life. If the cat is not hungry, then can potentially live another day. So during that time, because all my channels are in the do channel, are going in the do channel, so all my body are rigid. My entire body is rigid. um, I will have no sensation of pain because there's no energy in my body. um, so essentially all the African animals, when they're caught and being eaten, they're being eaten alive, but they have no pain. So in this regard, the universe is really, really benevolent. um, so I'm rigid and as if I'm dead. I'm motionless as a mouse. But a few senses are still up and running. My sense of smell, my sense of hearing, my sense of vibration, my sense of temperature, for example, all these senses that's needed to detect if the cat is still around. So if after going through certain time, all these senses are confirming that the cat is gone. There's no more cat around. Okay, the cat was well fed and would just want a toy. And being rigid is not fun. So the cat is gone. So at that time, what the mouse will do is like any dog would do when coming out of water, is it will shake its head, along its neck, okay, and then just shiver down the spine, all the way down to its tail. And that motion, that very motion, would redistribute all the pulled up, all the energy that goes into the do channel, and basically redistribute back into where it's supposed to be. So the mouse will take a few steps as if it was drunk, and then it will, just run away. So this is a pause condition. Okay, so pause is just a beautiful, beautiful design or beautiful evolution, or to me, it's just magical. Okay, at the time where when our life is hanging on a thread, we need pause mode. Okay, people in severe car crash, um, people in severe physical attack, um, or sexual attack, right? People in dire situation where their life is hanging on a thread, that's the mode they get in. Okay, very, 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 very important mode. Okay. Dissociation is slightly different. It's not severe. We're not, we're not at the very edge of life and death. But let's say I go hiking, and it's getting dark, and it's getting cold, and I'm all by myself, and I sprain my ankle very, very, very badly. If I continue to associate with my ankle, and the channel energies are still going to my ankle, I'll probably be passed out. I'll probably pass out from the pain. But we have a mode we call dissociation, where my brain can literally disconnect from the injured part of my body, so that the energy, the channels, don't even go there. So I would know my ankle is badly injured, but I can still walk down the hill and get to safety, and hopefully get a good treatment and re-experience the pain, reconnect my brain connection to my ankle, and truly heal and get back to the rest and heal, which is the parasympathetic mode. Okay. But again, a lot of people don't do that. So people who suffer severe trauma, a lot of times what I saw in the clinic, and maybe you have this experience, and maybe you are, I actually made a vow to serve healers. To me, healers are people who have trauma, and internally they have this beautiful, strong will to heal themselves. And my vow is to serve healers. Okay? Because to me, healers are truly the hope of our entire world. Because when we have gone through trauma and understand it and come out of it and heal from it and connect to loving kindness all the time, we become lighthouses that no matter where we stand, no matter where we are, we have light. Not because we want to shine the light on other people, but because through trauma, through healing, we are always, always bright. Okay. So a lot of people I see in the clinic, they have traumas. So they are in pause or dissociation mode a lot. Okay. For example, certain parts of their body will be very, very rigid. And no matter what they see, which doctor they see, no matter what kind of medication they take, or CBD or cannabis or whatever, right? It just wouldn't move. Right? And oftentimes, we'll just talk for 10 minutes or something like that, and very quickly discover, that shoulder was pinned down during some very, very severe trauma. And to the entire body, that shoulder was dead or on the verge of death. And in this person's brain, there's still this questions like, is it okay for me to be alive? Is it okay for me to come back to life? Is it okay? Is it okay? Many patients describe this to me. It's like they have this little voice and just keep checking, and they just have to keep pressing it down. It's like, why am I having this voice all the time? The doctor said I'm okay. From all indication, I'm free from any illness and disease, and yet I have this constant chronic pain or constant chronic rigidity in certain parts of the body. What's going on? A lot of people dissociate from their body. I've treated marathon runners. I've treated um, triathletes, and their ankles are horrible. But they say, "Hey, John, I have no pain. I just ran a marathon and I, won third place or something dramatic like that." I said, "But you use dissociation." So these, many athletes, athletes like this, with, who use their mind, they're so strong in their mind, and they believe that my mind can conquer anything, right? When they get to the age of 40 or 50, when their body is not, their mind control over the body is not as strong, oh boy, they start to have all kinds of very, very severe issues. So this is very important. Okay, so what I just described was these four modes, right? All these four modes are essential. Okay, let me repeat this. Okay, essential for our well-being. Okay, if we're being attacked and if we're being chased, if we're being pinned down, if being, whatever, right? We need to get into these modes. The modes that's designed for overcome or to survive, whatever we're facing. But the key is, once the thing is over, we need to get back to parasympathetic. We need to get back to rest and heal. And this is what this society don't do. This is what we don't do as a human race anymore. The indigenous people know how to do this. Any member in the tribe, any kind of trauma, physical trauma, emotional trauma, they go into the wild and they get severely injured, through 3 days and 3 nights without water and food, for example. When this person come back to the tribe, they will actually celebrate, they will dance, they will have cry, they will do whatever for weeks to bring this person back, entirely back, to be fully associated and merge back into the society. We don't do this anymore. We don't do this as a human race anymore. We check the data, right? We check all the vitals and say, "Oh, you're okay now." We're not. Okay. Um, so a very typical case in the clinic is what we call the liver qi stagnation. Okay, liver qi stagnation, and this slide basically shows where typical blockages are. Okay, so on the very left side, it's a pericardium channel, and without going into any detail, or we don't need to be doctors to really take care of ourselves. Okay, if we can put our thumbs, okay, let's say the left thumb um, on the next to our nipple, basically, okay, in between the fourth and fifth rib, and just feel it. Okay, is it painful there? If it's painful, chances are, especially on the left side, there's some emotional issues that we're holding. There's certain emotional pain that we don't want to feel. Chances are there's like a west wing, like in the Beauty and the Beast, where we shove things in, emotional things or past memories in there, and shut the door and keep and trying so hard to keep that door shut. Nobody ever get close to that door, because when that door opens, we couldn't face that. Okay, this I see in the clinic all the time. Okay. So what happens is when we have this blockage right at our chest, okay, and this can be basically around the entire chest, okay, underneath the breast, next to the breast, and on top, underneath the collarbone. If there's severe pain, and you can press it, and you will feel it. It's like, oh my goodness, how can I have such pain and I didn't know? The body is designed to protect itself, especially on the soft parts, on the front, okay, on our chest, on our abdomen, or a growing area. Okay, so if we have pain, what it does is it start to compromise our posture. Our shoulders start to come in, the head start to come, go forward, and all that is to say, okay, just so we don't feel these pains. But when we press it and it's painful, and you're ready, it's time to heal. And everyone's healing is critical. Okay? The way to heal is we just take care of ourselves. Give ourselves the space, the time, the understanding, not from other people, from ourselves. Deeply talking to ourselves, deeply communicating to our heart that the time has changed, we're safe now. Then really address our pain. Okay? So when there's blockage around the chest, the liver channel that's supposed to run from our big toe up our inside through our abdomen area and flow through our chest and all the way up into our lung channel gets stuck right around our chest area, and start to flow into our stomach, which causes bloating, indigestion, or severe, or just over appetite, just eat all the time, or doesn't want to eat, cause a lot of problem with depression, a lot of problem with anxiety. Why? Because we have a blockage on our chest. And why is that blockage there? Because we have things we haven't resolved yet. We have emotions that we've been pushing down, you know, for decades even. Okay. So that's how we, in the clinic, that's how we see. And when we do this, it's very objective. It's not like, okay, we're poking your past or something like that. There's something very, very tangible that we're working with. And these channels, because they're electrical, we can learn to feel the channels. And this is what we do in the clinic. Our hands are like diagnostic tools. Our hands are like MRI machines. And the patient come in and we will know instantaneously how this person's channel flows. So a lot of times this is how I feel. I will feel the channels, and I will feel like, okay, there's a blockage along the chest, and we'll say, well, you know, then we can start to go into it, and it's nothing personal, right? So that's why I say when a person is ready to heal, um, a lot of times it's really, really quick, okay? Very, very quick. Okay, on the next slide, it's basically a slide that's information that I get from my teacher, Janice Hedlock. So she had a view on COVID-19. Okay, this is COVID-19 symptom management in terms of channels. So the COVID-19, like all viruses, they basically they have a signature. They affect certain parts of our channels, and it's very, very predictable. Okay, so that's why like seasonal flus, for example. Okay, before when my teacher would have a clinic, she would treat the first flu patient coming in very very carefully, and then the next and the next and the next and the next. To her it's basically the same. She can basically say, oh, this is your symptom, and she will basically resolve that really really quickly. Okay, so COVID-19 is no different. So COVID-19 has three spots, okay, that kind of blocks our channels. One is on the do channel, in the back of our do channel, okay, right along our mid back. And when this channel is blocked, it causes tremendous fatigue. It's like we cannot stand up. Okay, we just have to lay down. Okay. It also causes, so during the daytime, the do channel actually enters the midbrain and come out of our third eye, basically in between our eyebrow. So actually affect the midbrain path. Okay, this is why COVID-19 is deadly. It's very very dangerous, because when our midbrain has no energy, our whole immune system shut down. The entire immune system is run by the midbrain. So all the immune system, or our will to survive. I've actually heard news that certain doctors, when they contract COVID-19, they kill themselves. When our midbrain is not energized, it's just like there's no point of living. Okay, this is how severe this thing is. Also, it affects our large intestine channel along our elbows, and it can be on both sides. Okay, so when this doesn't work, it affects our sense of smell, our sense of taste, and appetite. Um, so what we do is, basically we just massage these points, especially along the elbow and along the back, and can't really massage the midbrain path. So the suggestion is, what we did in the beginning is we elevate our perineum. I have a purpose, and we connect to loving kindness. And through loving kindness, maybe connect to happy kids, the music concert that we went to, something that's uplifting and really make us feel connected. Okay, that's pretty much all the presentation I'm making. I do accept donations, and any amount will support and encourage me. So on Clubhouse, you can click on my bio, and there's give money, I think, at the very end. And I do have Venmo and PayPal as well. Again, any amount will support and encourage me. Okay, and with that, I'm gonna open up the mic, and please share your thoughts and ask questions. Then I can go deeper into areas of the channels. Does it make sense for people, or what do you guys think? Are there any acupuncturists in the house? Maybe on the Zoom side?
Hi, John. It's Daniela.
Hey, Daniela, how are you?
Hi, doing well. Not an acupuncturist, but massage therapist.
Awesome.
And yeah, I definitely, after attending a few sessions with you, have incorporated this approach in with my clients, and I've noticed a huge difference in my work. And I can't even put my finger on exactly what is different, but I do notice a difference in how I interact with my clients and the results that we're getting. So I just want to say thank you. Thank you for putting this together and bringing it to us.
Absolutely. Thank you. So Daniela is she's on Zoom side, and I'm repeating this for Clubhouse. She's a massage therapist. We shared this a few times. She's actually a Wing Chun practitioner as well, so she knows how to use her perineum very well. So what we shared, the main thing was actually when she, do manual therapy, she's connected, right, to from her perineum, from a sense of purpose, and hopefully connect to loving kindness as well. This is actually very very important for practitioners of anything. Okay, if you're a nurse, a doctor, a firefighter, a caregiver, for example, if you care for your kids, care for your parents, this is very important. And let me go through this slowly. Okay, so essentially, if we can do this all the time, and this is honestly my practice all the time when I'm mindful, is I elevate my perineum a little bit. I have a purpose in my heart, and I connect to loving kindness from my third eye. And from there, I connect to my patients, I connect to my parents, I connect to my kids, I connect to my friends, I connect to my dad who passed away last year. Through loving kindness, okay, loving kindness is timeless and spaceless. Um, so there's no sense of, okay, that person is gone. Okay. Um, so we can always feel the love of the people that we love, and we can always love them from our heart. So when we do this, and for example, if I'm in the clinic and I connect this way to my patients, um, then I'm not sacrificing myself. I'm not using my energy. I'm not exhausting myself. I'm not getting this patient's energy. We're not exchanging energy. I'm connecting to the source of loving kindness, and my patient is connecting to the source of loving kindness as well. So when both are ready, both are receiving exactly what they need. Okay, so this is what this is mutual healing, and we'll be talking more about this about 3 days from now. Yeah, thanks, Daniela.
Thank you. Quick question. I won't be able to attend all of these talks. Is there a way that I can like get the recording or see them or listen
Absolutely,
after?
absolutely. So in the chat window, there's a link. Okay, tiny URL talk MCA on dash en. So that's a Google Drive or Google folder. So all my slides are in there, and today's recording or all the recordings will go into that folder. So because it's a Zoom, it's actually a video that has all the slides. Yeah,
Okay, wonderful. Thank you.
absolutely. Thanks. Any other questions, comments? Um, hmm. Many people have migraine, for example, or high anxiety.
My daughter is 5 and has started developing migraines. Is there anything that I can do to help with that?
Yes. So, so the first thing I would do is probably touching her toes every night, especially the little toes, um, and really notice like how her posture. How's her posture? Um, when she walks and when she runs. Um, is she kind of tight or rigid when she do certain things? Um, has she rolled an ankle recently or maybe 3 months back, something like that? So all these I would take into consideration. Um, yeah, something like that. Does that make sense?
Yes, it does.
Okay. And migraines are important. Okay, especially very young, having a migraine. That's actually very very important. We can actually look into potential digestion issues. Elimination. Does she go to the bathroom or every day? That's very very important. And potentially emotional stress, like going to see somebody or going to school or being put in a certain environment where she doesn't really want to. So all these are consideration as well. So yeah. So that's the fun thing about being a parent is we get to we get to look at all these things. And if we don't, we're very frustrated. Yeah. Anybody on the clubhouse side? Any question, comments? Um,
Hello, I'm from Taiwan. I received the information from my friend,
yes.
and I am studying counseling psychology. So I thought while you mentioned about PTSD was very, very interesting. I would like to share your talks with people who are especially studying about PTSD.
Yeah, I'd really appreciate that.
Yeah, and yeah, I don't know if there are any Chinese medicine doctors in Taiwan who are connected to the work you're sharing because yeah, that's where I'm from. So yeah, I hope that maybe there will be more doctors who are tuning into that so they can use this also to help people in Taiwan with PTSD.
Yeah. So this is, yeah, thank you so much. This is really my vow, right? My vow is to share what I know as freely and as widely as I possibly can. Um, yeah, to me, I received this gift, and the only way I can keep this gift is keep sharing. So there's one Chinese medicine doctor in Taiwan. I think she's in Taichung, and we worked together for a while. I don't think she is ready to treat PTSD, but she understands kind of what I do. If you're interested, um, to treat PTSD using this method, actually, it's more about it's it's really not about the approach itself. Okay, the approach itself, honestly, to me, is very very straightforward, very simple. Within 10 hours, I can share everything I know with you. The hard part can we is our own cultivation, our own sense of connection and how we see people. Um, you know, how much sympathy do we have? Um, do we empathize? And so that's the fourth day. Okay, that's the day we talk about sympathy, empathy, compassion, and that to me depends on the person's, the initial cultivation. That can take, you know, a year or maybe even 2 years or maybe even longer to really get to that point. So again, this really is an approach, right? So approach, if it resonates with you, um, there are certain practices that we can do. The main practice really is just, this perineum, this heart with the purpose and the connection to loving kindness. And through this, it sounds redundant, right? But honestly, this is the key: is we're not connecting to other people directly. We're connecting to other people through loving kindness. And when we do that, we see other people's heart. We don't see PTSD. We see a heart that's surrounded by trauma, by fear, by anger, by injustice. But we see that heart. We just, we lock into that heart of gold. Okay. A heart of gold that's never broken. We'll be talking more about this. That's really the key of PTSD treatment in my clinic is I don't see people with PTSD. I don't see people with heart broken. There's no broken heart in my clinic. We have broken connections. So that's really the key. Our heart are always, always golden. Okay, everybody's heart is always golden. We feel it's broken, but what's broken is our connection. And to remake that connection is a choice. It's a choice that anyone can make. Okay, I'm not a Christian, but in the Bible, it's like if we accept Jesus Christ as our Savior, then we're saved. So there's nobody, no God, no Jesus Christ, no Buddha, no other energy can basically just save us automatically, or without our, nobody can save us without us saying, I want to be saved, without us choosing. So we have this choice to say, okay, I have a heart, I have a heart of gold, I have a purpose. Everything I've been through has a purpose, and I connect to loving kindness. And boom, PTSD is on the healing side. Okay. And I will keep this in mind. I will touch up on that subject. Thank you, Teresa. And this connection to me is so important for any medical people, frontline workers, nurses, because otherwise, I mean, honestly, this whole entire mindfully centered approach was inspired by two teachers. They're both what I call wounded healers. They're wounded emotionally, physically. They're so tired. Their bodies are so broken. Their heart through empathy and sympathy are so broken. At first, I thought it was so noble. People who are willing to sacrifice themselves for the benefit of others. But after a month or two, I just feel like it was so cruel. This is the cruelest thing. I want to be in a position to serve people. I want my kids to serve people. I want everybody to serve others. But if that's the path that any so-called healers is going to end up with, being wounded, that's not acceptable to me. So this is why this talk, this mindfully centered approach came up, um, and this is why I want to share, because I see so many healers, and that's why my vow is to serve healers. I see so many people in healing positions or in service positions get wounded. They're filled with injustice, we're filled with pain, and both emotionally and physically. Yeah, thank you. Okay, this is going slower than I expect. um, the previous, yeah, feed me questions, please. We have half an hour to go. We have, the more you ask me, the more I can speak.
Well, thank you so much for sharing. It's me again, Faith. And
Yes.
yeah, why you share about the technique of elevating the Pinarinian a little bit. And I think it's a good way for counselors to be grounded and connecting to our heart, connecting to others, to the clients through our hearts. So we're in a centered space to listen, to help the other person. And if there's nobody else asking questions, then I'm interested to know about healing TMJ, because I've had wisdom teeth extraction before, and probably due to some stress. So I've been trying different therapy, and I think I am already doing a lot better. It's just a little residue of a little bit tightness in my right side of my head, but I feel that my right side of how I'm sitting is like not really properly. Someone said that because when I was young, kids play jokes, they take the chair away from you and then you sort of fell on the floor. They said maybe I hurt my close to my tailbone or something. So I'm just curious from your practice if there is something that you can suggest that I can do to help myself. Thank you.
Absolutely. Thank you, Faith. Um, So the question was TMJ, and this person was probably somebody removed a chair when she was a child, so she sat down and potentially um, move her tailbone a little bit. Okay, so when she sits, she's kind of sits on one side. So if you sit, okay, on a not so soft chair, and you have problem getting both of your sit bones to evenly carry your body weight, um, then it's a good sign that you have a unbalanced pelvis. Okay. Or if making the tailbone or the sit bone evenly distributed, you feel like you're off, you're just not balanced. That's probably a good sign of that too. Okay. So childhood, I see this very, very often. So when our tailbone is shifted, we actually get into a fight and flight mode, and potentially a dissociation because it was painful. Um, and if the kids are laughing and we just have to stand up, even though there's severe pain, and we just have to get up and go somewhere, right, where people are not laughing, we'll dissociate from it. Okay. And because we continue to go to school, and when we walk, we have to walk sort of normally just so people don't notice. So we learn to dissociate from it through motion. Then over time, there's basically a disconnect. It's like, okay, the brain just doesn't connect to that part anymore. Okay, this I see in the clinic quite often. And when the tailbone is shifted, what happened was, um, essentially the base of our entire spine is tilted to one side, even though it's just a very, very minor degree. Potentially the spine start to change, start to get into this S-shaped spine. And all these are correctable. Okay, I'm saying this not to sound pessimistic. I'm saying this, all these are correctable. Okay, and the correction needs to happen right at the tailbone. Okay, and then the body can relax the back. Okay, what happened was, people with that condition, you will find their back is like, okay, on one side of their back will be tight, and then basically one palm up on the other side will be tight, and then we'll go back to the same side, one palm up, another side is tight. So all these tightness start to drag or to pull the spine to one side. So that's the reason for the spine having an S, sort of like an S shape. Okay, why? Because again, the tailbone is off, right? The foundation is off. And what that can do is cause, for example, and then you have a surgery or oral surgery, and then you start to have a TMJ, and that's very common too. Okay, the oral surgery, first of all, it's painful. The other, another one is, the mouth is open for a prolonged period of time. If there's any injection of anesthetias, it actually puts us in a sort of like a pause mode. Okay. So what I would suggest is, if you can get somebody to hold your left side, okay, along your left side of the face, left side of the chin, okay, just hold it, okay, and you just basically allow your entire head, okay, soften your neck and everything else, just fall into that hand, fall into the supporting palm. And make sure that person sits, or however that position is, that person is extremely comfortable. Okay, it could be someone's lap, for example. Okay, so you just the key is you will feel supported, and then basically talk to yourself. Okay, this is the same as how we resolve pause or dissociation. Is it safe for me to come back to life? Okay. Or is this TMJ pain, or is this pain I'm feeling on my right face, is going to kill me in the next 2 to 3 minutes? Okay, these sounds like ridiculous questions, right? But for people who have paused, they couldn't answer this question. Okay, so you can ask the person that supports you and say, What do you think? Is this going to kill me in the next 2 to 3 minutes? And that person will laugh out loud and say, of course, this is not going to kill you in the next 2 to 3 minutes. Then essentially you complete that loop, right? Remember the mouse that we're talking about, right? It's like, okay, you're basically putting a position where being attacked, okay, and there's nothing you can do about it. And the body can potentially go into these modes. And if you can do this and answer the question, it's like, oh, it's okay now. The cat is gone. Then potentially your entire nervous system can relax. Okay, your channels can go back to normal. And if you do the perineum, do the heart, and do the third eye connection to loving kindness, hopefully that start to restore your channel to parasympathetic. Parasympathetic. Yeah. Thanks for that question, Faith.
Thank you so much. That's very enlightening. I would try that.
Yeah. And for the work that you do, when you do this, honestly, this is it's actually very interesting, right? So when I work with healers, and especially people like in your capacity, right, all the experience that you have, right, are so valuable. They're like your gifts, right? So when you go through them with a different alternative, way to do this, when you look at this thing from a different perspective, and you experience this, and you feel it, and you carry this into your own field, um, to me that's why I have a sense of purpose, and everybody has a purpose. All these pains, all these the things that we experience, when we look back, it's like, oh my goodness, that's why that happened. Okay. Again, thank you so much. Okay. So that took about 7 minutes. So that's good. Um, any question or comments or something we can resolve, or attempt to resolve on the Clubhouse site? Okay. Um, okay. So if there's no question, we can end this early and start again tomorrow on the physical side. Um, or I really want to use up all the time because I really feel like there's things that we can share, um, but potentially there's an energy that's not flowing correctly. um,
Well, can I ask a question for my friend?
yes, please, Faith.
She wants to take up studying Chinese medicine in Canada because, we're both from Canada. But are you the teacher you're learning from? Is she based in? Are you guys based in the U.S. or is there?
Yes, Santa Cruz, California.
Okay, so in Canada, do you know of anybody who is studying this? If she's interested, to get in touch with them.
Actually, no. Yeah, the channels are probably more widespread, but I don't know the channel, like to be able to feel channels and resolve things from channel. I think are pretty much wide. There's probably a few practitioners, but I don't know how deep they go into. Because to do this work, honestly, it requires cultivation. It really requires that we look into ourselves very, very deeply. Um, and we'll be able to be as sympathy free as we possibly can, because otherwise we're gonna start to affect other people's energy. Um, um, yeah, but if you guys are interested, I'll be, I'll do everything I can to be a good resource for you guys. To be honest with you, because this is what I set out to do. This is my mission. Um, so anyone who is willing and resonate with what I shared, um, we'll eventually, I think we'll get together. We'll share as much as we possibly can. Yeah, I actually just have a couple people that I met at Clubhouse. They drove up from Los Angeles 5 hours. They came here. They stayed for about 3 days, and we basically were hanging out together for 3 days. And I shared basically everything I know with them. Um, so to me, I'm very grateful that you mentioned this, because to me, this is exactly why I want to do this, in Clubhouse, at Zoom meetings. And this is, I want to make these connections to people, because at some point this has to come out. We can't, the current ways to treat a lot of these issues to me are so, they're just so out of date, and it's not helping. And it's not, because I do see veterans. Tomorrow morning, I actually have a presentation at the local veteran hospital, for PTSD trauma patients. Um, so anyway, yeah, it just, if we have this sense that, we'll be connected, and we will. This to me is just how the universe works. Yeah,
Thank you. I will pass the talk information to her. Thank you.
yeah, I appreciate this. Thanks. Okay, if only you're gonna ask a question. All right, you're my designated questioner.
You mean me?
Yes.
Okay, I'm speaking from Zoom side because I find the voice actually it's better than on Clubhouse. So I'm
Yeah.
actually physically at the Zoom side.
Okay.
Yeah. So first of all, thank you for host. Just thank you for the talk again. Actually, I have been talking about MCM numerous times, and we have been working together on different patients and see a lot of cases together. But each time I can still get new things and get more things to think about. Actually, I do have a question, but I'm not sure if it's for today or perhaps for tomorrow, because and when we talk about dissociation, my question is a physical dissociation can be resolved by itself without knowing all these modes, or without a aid from someone like you, from a healer, to identify if this part is dissociated or not? Can it be possible just resolved by itself?
Yes. So Fengling, thank you. Thank you so much for asking that question. So the question is, can dissociation get resolved all by itself without knowing channels, without knowing all these techniques? The answer to me is absolutely yes. Okay. It can absolutely be resolved by a pair of loving hands, a person that loves us deeply, a person that cares about us. Okay. So that's basically what it needs, is for the reconnection to happen. So in the clinic, that's exactly what we do, right? So it doesn't require, somebody like us. Um, I'm sure, like, if, it can be easily a family member, a caring friend, right? Or even a pet, right? A dog that knows, certain parts of the body is in stress, and it would just get its head over there. And for us to feel right? To reconnect, to release that sense of fear that we're still in trauma. Yeah, absolutely. Yeah, absolutely. I don't believe there's any magic in Chinese medicine. Um, you know, and we all find ways, right? People everywhere in the world, um, in the past and the present, we find ways to heal ourselves. So this is definitely not the only way. Um, but I do feel like the underlining circuit, okay, the channels are universal. I do feel that, because I treat all kinds of people, right? Different color, different age. Uh, they all have the same channels. Gravity is gravity, right? So there's something that's common, but in order to make peace with our channels, right, to restore our channel flow, there are definitely tons and tons of ways to do this. But I feel they all involve caring or kindness or loving. Yeah. Thanks, Fengling, for the question.
Thank you, too.
Okay, so um, okay, Harry's here at Clubhouse. I'm gonna invite him to come up and ask me a question. He's probably clueless, like, what?
How are you?
I'm doing good. Today I run this channel talk and I'm not getting a whole lot of questions, which I'm very puzzled, but I guess that's good. Yeah. So Harry, if you have a question, please ask me.
Okay, I will. And I always do.
Yeah. So Glendy, do you have any comments? I think can I invite you up? If you have something to share, I would love to listen to it.
Hi, John.
Hello.
Can you hear me?
Yes.
Can you hear me properly? Yeah?
Yeah.
Okay. Just there's thought in my mind that I don't know. Do you still remember that I mentioned the back side of my neck? It is very painful. There's one muscle on my back shoulder. So which means when I turn my head, there's certain angle and it caused me really, really.
Yeah.
So recently that I found one method which is called Feldenkrais. Feldenkrais method.
Yeah,
Have you
Feldenkrais.
heard it?
Yeah, Feldenkrais. Yes.
Yeah. So it's very small movement, but if I do like 30 minutes, it's surely relief my pain at that moment.
Yeah.
But I'm sort of feeling the second day it come back again.
Right.
So how do you see about this? I still have some positive, or when I look at my iPhone, probably there is something wrong.
Yes. Thanks,
Would you
Glenn.
like to, yeah, thank you.
Thank you. Thanks, Glendy. So Glendy was asking, like, she has a pain on her left shoulder, and so when she turns, it's painful. And she used a method called Feldenkrais, which is a wonderful way to relax the body for doing very, very tiny small movements for about 30 minutes. and the pain will go away, but it will come back the next day. Okay. Um, so if this happens, what I will do is I will actually look deeper. I will look below the shoulders, along your chest wall, right, along your the side of your ribs, for example. If you press them or if you poke them, are there pain? Okay. If there's any severe pain, that means the left shoulder has probably been sort of locked up for a while. And this muscle pain is a result of all these tensions. So I see this quite often is so eventually, there's some symptoms, but there's underlying issues that's been there for quite a while. So you might want to poke around your chest, poke around at the side of your ribs, or underside, it's like, just your rib areas. So, for example, when we fall, or when we have a, any kind of accident or something like that, right? We normally focus on the area that gets the most pain. But a lot of times our ribs are impacted, especially our floating ribs. They're very easy to get out of place. People pregnant with, with a big child, for example, a big, uh, over 10 pounds, for example, and if their stature is not big, sometimes their floating ribs just get expanded, gets pushed out of the way, and they don't really come back after birth. So they live with this sort of dislocated rib for a long time, and this caused the entire side of the rib. For example, if the left side of the floating rib was pushed out, it caused the entire left side of the body all the way up to the shoulders to get locked up, because otherwise it's painful. So I don't know if you have that condition, but those are the things that I'll be checking. Yeah. Thanks, Gandhi.
I have a question again, John, it's Daniela.
Yes, Daniela, please.
I was wondering, do we need to have like a very thorough understanding of the channels and points in order to do this work, or how does that work? Can we have no understanding? Is it like a little bit goes a long way? What do you think about that?
Thank you. Okay, so Daniela's question is, do we need a thorough understanding of the channels, including the points, in order to do this work, right? In order to do self-care or as a manual therapy, Daniela is a massage therapist, to do the channel work? The answer is it basically takes half an hour to an hour to know all the channel flows. Okay, it'll probably take 1,000 times more or 100 times more to learn all the points. And to me, the points are not necessary at all. And when I say at all, I mean at all. Okay. All we need to know, the points are like, okay, the channel points are like cities along a river. Okay, like there are cities along the Mississippi River, right? But those are just cities. But so if we just know the flow, know the direction, okay, know the depth of these channels, which honestly doesn't take a whole lot of time. And when you work on your clients, you literally scan them, or you feel them, which doesn't I have the advantage to live pretty close to you, so maybe one day we can get together, and within basically 10 minutes you should be able to feel channels, and then you just practice on your clients, and pretty soon that becomes your second nature, and pretty soon you have a kid, so you can scan your kids' channels, and the key really is, once we start using it, it becomes second nature. It becomes super fast. And also when we scan channels, we become the perineum to our heart, to loving kindness, and through loving kindness, establish the connection to whoever that we scan, become very, very important. We don't want to we don't want to project our energy into another person, nor do we want to absorb energy from another person. So all this will get tied together. So the more we use it, the better we're gonna be, which is mutual healing. Yeah. Hope that answered your question.
Yes, thank you.
Thanks. Okay, we're 7:23. Okay, we're 7 minutes away. So 2 more questions and we're there. I'm really curious. Okay, one more ask. Any more question or feedback? Otherwise, we can close early today. All right. Okay. So that's what we're gonna do. I'm gonna stop recording.